A short history of health disparities in the U.S. As early as 1899, one of the most influential African American intellectuals of the 20th century, W.E.B. Du Bois, published The Philadelphia Negro, using social science methods to describe social and economic conditions that shape the quality of life and health status of African Americans. In 1906, Du Bois published The Health and Physique of the Negro American as part of the proceedings of the 11th Atlanta Conference for the Study of the Negro Problems. Du Bois used the methods of epidemiology to expose the myth that blacks suffered higher death rates in the North because of their racial inferiority. Du Bois documented how the poor health of blacks was directly related to the conditions of poverty, social and sanitary degradation, and lack of education in their communities. The next step in exposing health inequities and promoting increased health in the African American community was Booker T. Washington's Negro Health Improvement Week in 1915. This comprehensive public health education campaign evolved into the National Negro Health Movement and focused on the dissemination of modern public health hygiene to blacks living in poverty in the rural South. The program grew into a year-round campaign across the nation. In 1932, it was incorporated into a new federal office of Negro Health Works in the U.S. Department of Public Health as they began to further address these issues. In 1951, however, the Office of Negro Health Works was dissolved due to integration, and the longest sustained minority health campaign in U.S. history was ended. 34 years later, Margaret Heckler, Secretary of the U.S. Department of Health and Human Services, released the Secretary's Task Force on Black and Minority Health. This report documented excess deaths from 7 disease conditions, including cancer, cardiovascular diseases, chemical dependency, diabetes, homicide, unintentional injuries, and infant mortality, all of which were experienced disproportionately by African Americans, Hispanic, Native Americans, Asian and Pacific Islanders, and Alaskan Native populations. This report also included various recommendations to reduce the impact of these differences. Following this report, federal offices, including the Department of Health and Human Services Office of Minority Health, Center for Disease Control's Office of Minority Health, and the National Institute of Health's Office of Research on Minority Health, were started to manage implementation of the report's recommendations and to monitor changes in the various populations' health statuses. Over the next 2 decades, federal initiatives and efforts towards eliminating disparities increased. The most recent of these federal policies includes President Barack Obama's Patient Protection and Affordable Care Act. Signed in 2010, the act, also known as Obamacare, takes strides to decrease health and healthcare disparities, primarily by expanding programs that provide health insurance to disadvantaged populations. Although this is not the only step to decreasing health disparities, it is a major step in the right direction.